honestly exhausted and I don't feel well. I have a bit of fever. I did my test of COVID, so I'm COVID-free.
A day later, Maxime started finding lesions on his body.
So I noticed that I had, I don't know if you see it, having in my thinker this pimple that like strange that it appears in this part of the body, and also here you can see.
After speaking to his doctor, Maxime was encouraged to go to his local hospital in Milan for tests. Here he was placed in isolation, where health workers wearing PPE took swabs of his lesions.
I went to the internet and I saw all these like terrible pictures of the people with all over the lesions, and for me it was really kind of scary because like also I'm by myself and I don't know with who I can share that information as well, so like I felt a bit alone and I didn't know the algorithm, what I should do in this situation.
At first, Maxime wasn't sure whether to go public with his story because he was afraid of the stigma of having the virus.
I have a bad news. I've got a monkeypox. As you see, it's over here and some other spots.
He says it's important that people can talk about monkeypox.
It doesn't matter whether the person got the disease. It doesn't matter what the reason of the disease, It's the matter the person is sick and he needs the help. And if the person is going to be by himself, and doesn't know how to get help, what is going to be worse for this?
The World Health Organization says it's deeply concerned by the number of cases increasing across Europe. And this spike in cases is putting pressure on sexual health clinics here in the UK, who are often the first to come into contact with cases like Maxime's.
My fear will be that sexual health clinics in some parts of the country will be unable to offer people appointments in time, and that will result in spread of infection. Not just monkeypox, but obviously things like syphilis, LGV and other things.
The World Health Organization has stopped short of declaring this monkeypox outbreak an international public health emergency. But if cases continue to rise, that might have to change. Ashish Joshi, Sky News.